Hi there, and welcome to Lesson 3.7, Research Smart. This lesson is a strategic tutorial that was created for you to learn how to develop your critical thinking, analytical, and problem-solving skills to manage your healthcare more efficiently and effectively. This video may go a little fast, so if you haven't done so already, have the presentation notes in front of you. And be sure to watch the video all the way through for the first time, and then go back to the parts that you need more clarity on. After this lesson, you will know how to conduct research that will expose you to otherwise hidden information that will help you build awareness, growth, and foster discussion on you or your loved one's healthcare. And your lesson takeaways will be to know how to conduct research properly, master the ability to discern credible information from advertisements, as well as improve your ability to find answers to your concerns that will help you better understand health issues. Now, in order for us to reach our knowledge goals, this video will cover the definition of research and explore some reliable resources. We will then learn how to conduct research, as well as walk through the steps in completing a research index card. So what is healthcare research? It is the act of informal study to enhance communication, critical thinking, and decision-making skills within the scope of healthcare. Now let's take a look at some reliable researching resources. The World Health Organization, otherwise known as the WHO, is a specialized agency that is concerned with international public health. The WHO focuses on communicable diseases around the globe to improve equity in health, reduce health risks, promote healthy lifestyles and dwellings, as well as respond to underlying determinants of health on an international level. The Centers of Disease Control and Prevention, otherwise known as the CDC, is the leading national public health institute of the United States. The CDC focuses its attention on developing health promotion, injury prevention, and educational activities designed to improve the health of the United States citizens. The Centers for Medicare and Medicaid Services, otherwise known as CMS, is a federal agency within the United States that works in partnership with state governments to administer Medicaid. CMS also works with other commercial insurers to make more informed local coverage decisions and distribute community-based health information. The Food and Drug Administration, otherwise known as the FDA, is a federal organization that focuses on protecting public health by ensuring that things like drugs, vaccines, and medical devices are safe and effective for use in the United States. The United States National Library of Medicine, otherwise known as the NLM, is operated by the United States federal government and is the world's largest medical library. Its collections include more than 7 million books, journals, technical reports, manuscripts, microfilms, photographs, and images on medicine and other related sciences. This includes some of the world's oldest and rarest works. Fair Health Consumer, otherwise known as the FAIR, is an organization that was created to bring transparency of costs of healthcare. FAIR is an independent national nonprofit organization known for providing fair and neutral information. Their website is a user-friendly navigation tool for health consumers to research and acquire information about the costs of medical and dental services, as well as insurers. Now let's take a look at how we can identify credible information. If you plan on sharing your information, you will always want to make sure that there is a website that supports your claims. And you can qualify the website by simply answering these questions. Does the site have an editorial board? Is the information reviewed before it is posted? Does the information favor the sponsor? Does the site make unbelievable claims? Do they want your information, and if so, what will they do with it? Now let's look at some of the other ways that we acquire health information outside our doctor's office. People are usually introduced to subjects to research by the internet, print, radio, or television, but at times it could be word of mouth. Research is conducted in 4 steps. In this slide, I have created a flowchart for you to follow. First, identify the subject. Now, this could be anything related to health. Number 2, categorize the subject into one of the 3 branches in healthcare. Number 3, further classify the subject into the predominant characteristic, whether it be the location, the drug or device, or money. Lastly, document where you found it. At times, you'll want to share your research with another member on your care team or your provider. If that's the case, Patient Better created a tool for you to provide an organized snapshot of your findings to make communicating your research easy. So in this last chapter of this video, we're going to go through how to fill out a research index card. First, circle in where your initial interaction was, and if it's the other, explain in this field. Write down the subject or topic of your research in this field. Write down the website, and if there isn't one, go back and look for one. This is an extremely important additional step to gain credibility fast. Write down the date that you found the researched subject, and if there is any, document its initial publication. And lastly, in the comment field, write down the disease, illness, injury, or claim that the publication makes. Now remember, the less words the better. Optimal words are between 3 and 5. Lastly, let's take a look at how to talk to your provider about your research. The best time to share your findings is with a licensed professional in the treatment room. That way, they have your undivided attention. If the professional is unable to answer your question during the encounter, then simply supply a copy of your research card and then ask them to get back to you within the next couple of days via email. Now let's take a look at how to approach your insurer about your research. Approaching your insurance company about what you want to talk about regarding finances is super easy. All you have to do is give them a call. You have representatives waiting to help you out. Now remember, researching is a skill that needs to be developed and will become easier to do once you have done it the second or third time. After all, when you keep researching and developing, you are refining your communication, critical thinking, decision-making, and observation skills. And that concludes our video and our course for today on how to conduct research properly. Be sure to join me in our next course to further develop our communication skills that will help us become more refined health advocates and have a more active role on our healthcare team. Bye for now.